We have an opportunity to make history together, to eradicate polio and ensure that no child is paralyzed by this disease ever again.
Thanks to the work of the Global Polio Eradication Initiative, courageous health workers, and leaders all over the world, we are over 99% of the way there.
We've protected over 3 billion children with polio vaccines since 1988. 2 of the 3 wild polio strains are gone, and 20 million people are walking today who would otherwise have been stricken by polio. The progress is remarkable, but we are not done yet.
Until we stop polio for good, it will always threaten to resurge, paralyze more children, even in countries that beat the virus decades ago.
That's why the world must come together now to capitalize on wild polio cases being at their lowest levels ever, and to urgently work to overcome all remaining barriers to a polio-free world, including the spread of poliovirus variants.
The polio program is no stranger to rising to the challenge. We have beaten polio in some of the most difficult geographies on Earth, and we'll use this experience to keep adapting to reach every last child with the polio vaccine.
We'll continue to innovate, deploying a next-generation vaccine to more sustainably end polio outbreaks and the latest tools to track the virus to its final hiding places.
And we will ensure that the eradication efforts improve health more broadly, delivering other vaccines and health services to communities and continuing to support countries in tackling diseases like measles and COVID-19.
The polio program has a clear plan to finish the job, but this alone will not get it done.
To realize a world without polio, we urgently need sustained commitments from governments and $4.8 billion to fully implement the eradication strategy.
This investment will not only consign polio to history,
it will build a safer, healthier world for all.
Let's seize this opportunity. Let's end polio once and for all.
Thank you. Dear colleagues and friends, thank you for joining us for the launch of the investment case for polio eradication. In February, we received confirmation that wild polio virus had paralyzed a child in Malawi. The virus strain originated from Pakistan. While it does not affect the WHO African region's wild polio-free certification, it shows us that as long as polio continues to circulate anywhere, it's a threat to children everywhere. That's why we cannot afford any let-up in our quest to eradicate polio once and for all. In the last 2 countries endemic for wild polio virus, Afghanistan and Pakistan, transmission is at historic lows. Sadly, Pakistan reported its first case of polio in 15 months. Despite this news, we have a unique window of opportunity right now to end polio for good. The world is more than 99% of the way there, thanks to the tireless efforts of frontline workers, communities, local governments, and global partners, including Rotarians around the world. Today, nearly all the world's people live in polio-free countries. Polio eradication would be a historic achievement for the world and a major milestone in human history. To seize this opportunity, the Global Polio Eradication Initiative is implementing a new 5-year strategy that introduces innovative new tools and tactics to break the final bottlenecks. To fully implement this strategy and end polio for good, the GPEI needs $4.8 billion. This support is critical to achieving eradication, expanding essential health services in underserved communities, and leaving a legacy of healthy children around the world. This will bring about benefits beyond just eradicating polio. The polio program helps to deliver other health services like routine immunization, vitamin A supplementation, and respond to emergencies like Ebola and COVID-19. This investment will also strengthen health systems by integrating polio infrastructure within broader health programs. Eradication is highly cost-effective and will be associated with significant economic savings, estimated at more than $33 billion US. Every child must be protected from this disease. We have the tools and expertise. Now we need support to finish the job. Right now, we need bold commitments, both financial and political, to consign polio to history books. And of course, we can only realize the dream of a polio-free world with close partnership. Since the formation of the GPEI almost 25 years ago, UNICEF has been a steadfast partner, supporting the supply of vaccines and building trust in communities. Unfortunately, UNICEF's Executive Director, Catherine Russell, cannot be with us live today, but she has sent a video message which we will play now.
Excellencies and colleagues, I'm so sorry I can't join you today, but I'm on mission in the Horn of Africa, where the situation facing children grows worse by the day. But I did very much want to share a few thoughts at this critical moment in our fight to eradicate polio. Our collective goal, a world in which no child is paralyzed by polio ever again, is within our reach. But as we expected, the final stretch is the most difficult. We're facing persistent challenges in the countries where polio remains endemic. We are also facing outbreaks of non-wild variants of the polio virus, especially in countries where not enough children are fully vaccinated. The COVID-19 pandemic has exacerbated these challenges. The 4-month suspension of polio campaigns in more than 30 countries during lockdowns, coupled with related disruptions in routine immunization, led to tens of millions of children missing polio vaccines. From 2019 through 2021, more than 2,000 children were paralyzed by non-wild variants of polio. While campaigns and immunization activities have resumed and cases are declining, even one child with polio is one too many. These non-wild variants thrive in remote or mobile communities. They prey on children affected by conflict and fragility. For these reasons, we have seen increasing outbreaks in Nigeria and several African countries, in Yemen, and most recently in Israel and Ukraine. UNICEF, the World Health Organization, and the Global Polio Eradication Initiative are working with our partners on the ground in Ukraine and in neighboring countries to strengthen disease surveillance. We're also using the response to deliver vaccines against polio and other diseases, and to extend health services to children and families who've been displaced by the war. This kind of flexible, targeted response is what we do best. It has been a key to our success this far, supported by the unwavering commitment of governments and donors and the relentless effort of thousands of health workers and community partners. The new polio eradication strategy is designed to take us to the finish line. It includes dedicated tactics to protect children from variant outbreaks and stop their spread to other countries. One of these is a new tool, the novel oral polio vaccine type 2, which we're using to help stop variant outbreaks more sustainably. We're also working with governments to speed up our response to these outbreaks, acting immediately to ensure that they do not harm more children. And we continue working to integrate polio activities with other immunization and health programs, so we can reach high-risk children who've never received vaccines before. The new strategy will help us end all forms of polio. It will also help prepare countries to respond to future health threats. The polio program has been crucial in responding to the West Africa Ebola epidemic and outbreaks of measles, yellow fever, and avian influenza, as well as neonatal tetanus. More recently, the Global Polio Eradication Initiative has been helping protect communities against COVID-19, delivering COVID-19 vaccines, detecting and monitoring cases, lending lab support, supporting contact tracing, and raising awareness about the virus. This really is a pivotal moment. The choices we make will determine whether we stop polio for good or risk its resurgence. and the prospect of tens of thousands of children paralyzed every year once again. With an investment of $4.8 billion, we can fully fund the GPEI strategy and fulfill our promise to guarantee a world where polio no longer threatens any child's future. We cannot allow another child to suffer from this devastating disease, not when we know how to prevent it, not when we are so close. We call on the global community to take this opportunity and recommit to achieving a polio-free world for every child.
It is my honor to join Dr. Tedros and Ms. Russell in recognizing this pivotal moment in the world's efforts to achieve the global eradication of polio, and to speak to those who share our commitment to improving vaccine equity. During World Immunization Week, we celebrate the historic progress we have made in polio eradication and the achievements of our unprecedented vaccination efforts to reach children everywhere. And while vaccination is critical, eradication requires a global network of people tracking the disease, testing specimens in labs, strengthening immunization systems, and engaging communities. The investments we make in this network and in people carry additional benefits, helping build in-country capacity to achieve and sustain polio eradication, as well as detect and respond to other vaccine-preventable and emerging disease threats. Please enjoy this next video with the stories of some of the incredible people doing this work, bringing us closer to a polio-free world.
Our first step to stop polio is to find out where the virus lives. My team and I work with the community and the local health services to monitor constantly and to respond to any case of paralysis. We also teach families and community leaders how to keep their children safe and to recognize polio symptoms. If we think we found a polio case, we quickly send a sample to a lab for confirmation so we can stop a potential outbreak.
At the CDC Polio Laboratory in Atlanta, Georgia, we test samples from cases of paralysis to see if there's any polio present. It's not just this lab here. Nearly 150 labs across 92 countries help to analyze hundreds of thousands of these samples every year. We also test samples from the environment to get a complete picture of where polio might be circulating. If we find polio, we're able to identify the type and origin of the virus. These laboratory data inform public health actions to respond quickly to outbreaks and protect children from polio.
Before we start any campaign, we must engage with community leaders to gain their trust and support for the polio vaccination. I visit households. It is important to hear their concern and clarify their doubt and motivate them to vaccinate their children against polio. Also, during this pandemic, I am helping the family with important information on how to protect themselves and their family against COVID-19.
पोलियो के कतरे पिलाने की मुहिम के दौरान मैं अपनी टीम के साथ घर घर चलती हूँ, खानदानों से मिलती हूँ और उनके बच्चों को पोलियो के कतरे पिलाती हूँ। पोलियो को कम्युनिटी में फैलने से रोकने और बच्चों को मजबूत और सेहतमंद बनने में मदद देने का वाहिद तरीका पोलियो वैक्सीनेशन है। मेरा काम हमेशा आसान नहीं होता। बाज़ औक़ात हम ऐसे ख़ानदानों, कम्युनिटी मेंबरों से मिलते हैं जो अपने बच्चों को पोलियो के कतरे पिलाने से इनकार करते हैं। पुरसुकून रहने, उनकी बात सुनने और उनके शक व शुबहात को दूर करने बहुत हिम्मत और हौसले की ज़रूरत होती है। लेकिन मैं फिर भी अपना काम रोज़ाना जारी रखती हूँ हौसला अफजाई के साथ, क्योंकि मेरा मानना है कि पोलियो से कोई बच्चा मफलूज नहीं होना चाहिए।
With your support,
Your help,
Your support.
आपके ताउन से हम पोलियो का खात्मा कर सकते हैं।
A huge thank you to all of those in our last video and beyond who are working so hard together to end polio. My name is Shona Bari from the World Health Organization. These colleagues inspire and motivate us and are a reminder of the strength of our global polio network. The countries of the world made a promise a generation ago to create a world where no child would again be paralyzed by polio. The GPEI's new investment case outlines the support that is needed to navigate this final stretch of eradication and create stronger health systems in the process. We will now hear from countries that are at the forefront of ensuring that we continue to move forward towards eradication. I'd like to pass to Dr. Shahzad Beg, Coordinator for the National Emergency Operations Center for Polio Eradication in Pakistan, before we go on to hear from the Honorable Ministers of Health from South Sudan and Malawi.
Greetings from Pakistan, and thank you for the opportunity to share our country's program on polio eradications. While I can finally see the end of the tunnel, I also know that the journey to the end will be the most challenging. We have several indicators that point towards our sustained progress. The external surveillance review, which was conducted last year, has shown that our surveillance system is very robust and meet the required standards. With 71 environmental surveillance sites, our network is of high quality, meeting global standards. Still, we are working on the external review recommendations to make sure that we make it more robust and more stronger. We know as a program that our surveillance is telling us that the virus is in South KP. A South KP plan is being implemented, which focuses not only overall improving the quality of the campaigns, but also strengthening routine immunizations, improving the health facilities in those areas, as well as organizing health camps and make sure that all the medical positions which are lying vacant in different cadres, they are filled in those areas. The next area of concern for us is the Pakistan and Afghanistan border. We know that the virus is across the border and there is a big population movement between Pakistan and Afghanistan. That is where we are also focusing. We are making sure that all the transit routes which the people use to cross the borders, we have transit vaccination points in those areas, and all age vaccination is being done. All the success which we have made in the polio program so far is because of the dedication and the sacrifices and hard work of our polio frontline workers. Before I close, I want to thank all polio partners, the international development community, our donors, and all the stakeholders for their support over the years. I believe it is time to only amplify this support. Like all children in the world, the children of Pakistan and Afghanistan deserve to have a life free of any disabilities, any paralyzing diseases. With continued global support, we can make polio a disease of the past. Thank you very much.
Hello, everyone. Please receive greetings from South Sudan, and thank you for having me today. It is an honor to participate in this launch of the investment case for polio eradication program new strategy. Our country recognizes the importance that this strategy receive the full support it needs, not only to end polio everywhere, but to improve the broader health of communities all over the world. 18 months ago, South Sudan experienced an outbreak of circulating vaccine-derived poliovirus type 2 due to importation, which began to spread through communities where enough children were not protected from the polio. Out of this outbreak, 59 children were paralyzed. But with the support of the polio program and the urgent response from the Ministry of Health, we were able to prevent further damage. When circulating vaccine-derived poliovirus type 2 emerged, we quickly implemented a far-reaching response to halt its spread. The government declared the outbreak as a public health emergency in September 2020. Social mobilizers engaged with communities and influencers to spread the word on the importance of getting children vaccinated. Our healthcare workers travel house to house to deliver life-saving vaccines while adhering to COVID-19 safety measures. We immediately boosted disease surveillance to track the virus in the environment before it could reach more children. Because of this swift action, I am proud to confirm that polio has not harmed a child in South Sudan since April 2021. None of this work would have been possible without the support of the polio program, which is doing so much more for our country than just juggling one disease. For example, polio infrastructure has been critical to strengthening coronavirus surveillance, and it is helping to monitor the emergence of other vaccine-preventable diseases, ensuring we can respond quickly and boost routine immunization where needed. Given the importance of polio infrastructure to the broader health of our communities, our goal is to fully transition it into our national health system, as other countries have done. However, the country's context, this may take time to fully transition. In this regard, we need more donor support beyond the 2-year extension for transition until the global polio eradication is declared. In short term, we rely on the polio program to keep us vigilant against polio and prevent its reemergence and to protect our people from other health threats. That is why it is so important the program receive the funding it needs. It will help both realize a polio-free world for everyone and provide the foundation for building a healthy and vibrant South Sudan. We remain committed to protecting all children from polio and look forward to working with all our polio partners to rid the world of this disease. Thank you for listening.
Greetings from Malawi. I join you today at this critical moment in the work to end polio around the globe. For 30 years, our country, Malawi, has lived without polio, a testament to our healthcare workers and communities who kept their children safe with vaccines every year. Yet, despite our continued efforts to protect our children, the world polio virus found a weakness in our defenses. Last year, a young girl in Lilongwe was paralyzed by wild polio, which was linked to a virus strain imported from outside the continent. This was a tragic reminder that until polio is wiped off the face of the earth, it can spread globally and harm our children anywhere. We knew that we had to act fast, and immediately we declared a public health emergency. And we notified our neighboring countries in the process so that they too could coordinate and help prevent any further polio cases. Thanks to the support of World Health Organization, but also to Global Polio Eradication Initiative, Malawi rapidly strengthened its disease surveillance to track polio spread, but also began to work to vaccinate children across our country. This response is not a one-off. We know the work must continue, and we remain committed to stopping polio. In the coming weeks, Malawi will conduct more vaccination campaigns and coordinate with our neighbors to protect over 20 million children in the region against this disease. I am confident that our collective vigilance will bring a swift end to the world polio and protect against the disease that Africa fought so hard to gain. I'm also confident that we will achieve this because of the continued support and expertise from the polio program. Without our polio partners, Malawi and indeed others could never have mounted such a rapid response against the world polio. I urge all countries to unite behind the Global Polio Eradication Initiative and to ensure it has the support and the resources it needs to end polio for everyone, everywhere. And I call on our country partners across Africa to stay alert against all forms of polio and respond urgently whenever a child is threatened by this terrible virus. There is a clear strategy in place to achieve polio eradication, and Malawi is committed to helping the world realize this goal. Thank you so much.
Thank you to each of our speakers. To close the first half of today's program, I would like to welcome Mr. Niels Annen, Parliamentary State Secretary in the Federal Ministry for Economic Cooperation and Development of Germany. None of the progress would be possible without the continued support of our donors. Germany has been with the eradication effort since it launched, and we're delighted to hear from State Secretary Annen.
Excellencies, dear colleagues, ladies and gentlemen. Today, we are launching the investment case for the Global Polio Eradication Initiative. It is my honor to join you for this occasion. A polio-free world is within reach. This will make polio the second human disease ever eradicated. Through our collective efforts, the world has driven polio cases down by 99%. This has saved 20 million children from long paralysis, an incredible achievement for public health. Every child, no matter where they live, deserves to be protected with polio vaccines. But eradicating polio will do much more than tackle one disease. It will help deliver other critical medicines, health services, and immunizations to remote communities, reaching children who have never been protected with vaccines. Also, the polio infrastructure will continue to help countries fight emerging health threats, as it has done with COVID-19. A strong and fully funded polio program will benefit health systems around the world. And that is why it is so crucial that all stakeholders now commit to ensuring that new eradication strategy can be implemented in full. Germany is committed to finishing the job. That is why we support this investment case to collect the $4.8 billion outlined. With this funding, the polio program will be able to vaccinate almost 400 million children annually for the next 5 years in order to end this disease once and for all. I am delighted to announce that Germany will continue to champion polio eradication. We are therefore going to co-host the polio pledging moment at the World Health Summit in Berlin this October. This event will be a critical opportunity for donors and partners to reiterate their support for a polio-free world. During its presidency of the G7 this year, Germany will continue to advocate among global leaders for a joint approach towards the most pressing issues in global health, including, of course, polio eradication. We, ladies and gentlemen, we can only succeed if we make polio eradication our shared priority. I look forward to welcoming you to Berlin later this year. Thank you very much.
Thank you, State Secretary Annen, and to Germany for confirming they will host the first pledging opportunity for the new GPEI strategy. We look forward to joining you at the World Health Summit in October. This concludes the remarks from today's program, and we can now move to the media Q&A with polio representatives who have just joined us. For media in attendance, you're invited to submit your questions for our panel using the Q&A function. Please include your name and organization when you submit your questions. I will then direct these to our panel of experts. If we are unable to answer your questions within the time frame, please be in touch with us via the email at the address in your event confirmation. I'd now like to welcome our panel of experts from across the partnership: UNICEF, Rotary International, the Bill and Melinda Gates Foundation, the World Health Organization, and the U.S. Centers for Disease Control and Prevention. I will start with a question from Devin Thorpe, which I'm going to ask of Anand Bandyopadhyay, who's the Deputy Director of Polio Eradication at the Bill and Melinda Gates Foundation. Anand, the question is, the novel polio vaccine doesn't have the risk of generating circulating vaccine-derived poliovirus cases. Is there a plan to make a switch to this vaccine exclusively? Is COVID vaccine production interfering with production of this novel vaccine? Thank you, Anand.
Thanks to you, Shona, and thanks to Devin for the question. So the novel oral polio vaccine type 2 has substantially lower risk of generating circulating vaccine-derived polioviruses. And this has been demonstrated in clinical trials, and also the field use of the vaccine has been very promising. In terms of a complete switch to this novel vaccine, there is no plan to essentially switch in terms of routine immunization use of this vaccine. Of course, we would want to continue to use the novel oral polio vaccine type 2 for outbreak response, in addition to the current tools that also exist, like the Sabin monovalent OPV2 and also trivalent OPV. And basically, based on the field use of the vaccine, the plan will be to transition to using the novel oral polio vaccine type 2 for outbreak response over a period of time. So that is really the current plan, Shona.
Many thanks. We now have a question from Helen Branswell at STAT. Thank you, Helen. And I'm going to direct this one to Dr. John Verdefay, who's the Polio Eradication Branch Chief Incident Manager for the Polio Emergency Response Center at the U.S. Centers for Disease Control and Prevention. Helen's question is, if GPEI is able to raise the $4.8 billion it seeks, does it believe it will be able to complete eradication by 2026? Is this potentially the last ask from GPEI? Over to you, John.
Thank you so much for the question. Our strategy is very committed to that. And I have to say that in my many years of doing this, we've never been closer than we are right now to eradicating wild polio virus. We've never seen these low rates for WPV in the world previously. And right now, the efforts in Pakistan, the efforts in Afghanistan are poised to help us push through and stop transmission and achieve eradication.
Thank you, John. Our next question comes from the Wall Street Journal from Saeed Shah. And the question is going to go to Dr. Hamid Jafri, who's the Director of Polio Eradication in WHO's Eastern Mediterranean Regional Office. Hamid, the question is, what is the situation in Afghanistan right now?
Well, the situation in both Afghanistan and Pakistan, as other speakers have said, it's the best epidemiological situation we've seen ever, and it's a unique opportunity. Afghanistan this year has only reported one case very close to the border with Pakistan and Afghanistan are really, we have to look at them as one epidemiological block. And in fact, this afternoon, we had a meeting between the two National Emergency Operations Centers to jointly plan in this common area across the border between Pakistan and Afghanistan, where the most recent wild poliovirus isolates have been detected, both in a case and environmental samples. In Afghanistan, since the change in government, there is now access everywhere, and nationwide campaigns have been implemented. They've implemented now 5 campaigns, and these campaigns are increasingly reaching children that the program was not reaching for more than 3.5 years because of a ban on mass vaccination campaigns in those areas. We are still not reaching all children, particularly in the high-risk areas of South Afghanistan and eastern region of Afghanistan. But increasingly, we are implementing campaigns now house to house, and this trend looks very promising right now. Back to you, Shona.
Thank you, Hamid. Our next question is again from Helen Branswell at STAT. And John, this is for you as well. Is GPEI concerned that it may be difficult to raise $4.8 billion at this time? With the war in Ukraine, the refugee crisis it has triggered, the ongoing COVID-19 pandemic, and a number of other urgent crises around the world competing for international aid dollars.
Thanks, Helen, for the question. Undoubtedly, these are complicated times, and we are very aware of the number of competing demands that are out there in the world that really are required for the global community to come together right now. We're also very clear-eyed about the fact that this investment is a critical investment that has to be made. If we are unable to raise the resources to eradicate polio, if we are unable to finish the job, the onward costs become much more substantial. And so there's really a couple of things that drive us. The first is that these investments both will stop polio forever. They will save the world over $30 billion by 2100. So for the remainder of this century. And also they impact other health systems and other parts of the health system in a major way. So the strategy aims to integrate and strengthen immunization systems and health systems to better protect the world as we eradicate polio, to better protect the world from other health events.
Thank you, John. The next question is actually a question that's been asked by a number of journalists on the line, so I'm sort of combining, and I'm going to ask Melissa to please answer this question. Are you still confident that you can stop transmission with the news of recent outbreaks in new countries, such as Israel and Ukraine? Melissa, can you hear me?
Absolutely. Thanks for the question. Absolutely. We know from experience that the strategy works. We are able to stop outbreaks when we're able to, even in complex emergencies, when we're able to rapidly get in and respond quickly with the available tools. We've been able to stop outbreaks in Nigeria, in Pakistan, and DRC. So the tools work, the strategy works. We just need to implement them on time. And then with new tools like NOPV, expansion of our rapid response teams, we're confident that we'll be able to put a stop to variant viruses as our experience shows the validity and utility of the approach. Thank you.
Thank you, Melissa. The next question I'm going to direct to Hamid. It's from Laura Sam Refashite, who's a freelance journalist. Could you give us some more detail on the recent polio case in Pakistan? And what does it mean for the eradication campaign in Pakistan?
Yeah, so this case, actually a child, was paralyzed. This is an 11-month-old child in the North Waziristan district, part of the southern Khyber Pakhtunkhwa or southern KP province of Pakistan. And this case and concomitant environmental detection in the district of Bannu really confirmed our assessment and our concerns that low-level transmission of wild polio virus was persisting in this part of Pakistan, because we had as recently as December of last year had detected related viruses in this part of Pakistan. So already the program had developed and is in the way of implementing an intensified emergency action plan focused on this part of Pakistan, South KP. I think the second important development is that this has happened at a time of change in administration and political condition in Pakistan. And in this regard, this event really demonstrated that it has actually redoubled the national resolve. So yesterday, the Prime Minister of Pakistan actually convened a meeting with the deputy commissioners of 25 highest polio risk districts in Pakistan, including in particular this part of the country of South Khyber Pakhtunkhwa, and really motivated them to finish the job. This case really is not a setback for the program. It is really what we expected on the pathway to eliminating the final remaining chains of polio transmission. And so I think this redoubling of the national resolve is very important, because this area has increasing insecurity, and the support of the security agencies in Pakistan at this particular time will be very important for reaching all children. This area also has very weak or absent health services. So there is a provincial and national resolve to establish broader integrated services with the polio eradication program. So the polio eradication program is supporting additional services, and it's highlighting the need to further strengthen immunization and other primary services in this part of Pakistan. And then finally, it also highlights the importance of cross-border coordination. Like we see in very advanced stages of polio eradication, and we have seen it in other countries like India and Nigeria, this remaining polio virus is most likely surviving in mobile and cross-border moving population. So the coordination with Afghanistan is particularly important in this regard, and both the countries are now working very closely together to track these cross-border population and the internally mobile populations to make sure that they come under surveillance and the vaccination teams are consistently reaching these children. So this, again, in a nutshell, this is not a setback for the program. It's sad that the child is paralyzed, but this doesn't really mean that the program is going backwards. Back to you, Shona.
Thank you, Hamid. I have a question for Dr. Tunji Funsho now, and this is from Yuming Sun at the Georgia Institute of Technology, who is wondering, based on your experience, Tunji, and your observations, what are the biggest roadblocks to eliminating circulating vaccine-derived poliovirus type 2?
Thank you very much, Sona. I think the roadblocks are just more than one. But if there's one particular one, one has to emphasize on is the low routine immunization coverage. I believe that if we are able to get our routine immunization coverage to such a point, and figures quoted about 80%, then the virus in whatever form will not be able to find residence in a child to the point of causing disease. The other one, of course, is as much as possible what we're doing now, because the outbreak response, is eating into a lot of our budget. The governments at every level, whether it's at the federal, state or local government level, are watching their purses and trying to see how much they can allocate to other areas that they deem are areas of priority. And therefore, funding where it is really essential for these outbreak responses sometimes are quite lacking. And of course, much less of a challenge in recent times has been non-compliance. We're having much less people refusing, but there are, and we need to reach those people so we can reach the kind of routine immunization coverage level that will guarantee that even if the virus finds itself in the environment, children do not succumb to the disease. And of course, the final one is the insurgency still persisting in some areas that is making it very difficult, for our vaccinators to reach all the children. But in Nigeria, the military, is assisting tremendously in ensuring that they, using the Armed Forces Medical Service, actually go to those areas that are relatively safe for the military, but not for civilians. And offer the children, the vaccine.
Thank you, Tunji. Thank you for that comprehensive answer. Our next question is from Kazim Balagun at eHealth Africa, and I'm going to direct this first to John, and then perhaps ask Hamid to add a few comments. The question is the GPEI planning to use learning from the progress being made in Afghanistan and Pakistan to proactively support other fragile states? John, would you like to kick us off?
Yeah, sure. Sure. Thanks so much for the question. So absolutely. I think that as we're thinking through strategies for how to proceed, we have a very active and dynamic learning that we do as we find elements of success and then accelerate them to bring us to eradication and to stop transmission everywhere. We're doing some real exciting work right now at CDC, looking at what we're calling consequential geographies, which say, okay, there are these places that tend to have impacts that go beyond their borders when it comes to outbreaks, when it comes to transmission of polio. And we are applying all of the lessons that we learn about engaging communities, about the importance of female vaccinators, about the critical ways to gather surveillance information, to apply those in those places to improve the system and to accelerate eradication.
Hamid, perhaps you could add something from your perspective as well. Hamid, you're on mute.
Okay, maybe the organizers could unmute. Can you hear me now?
Yes.
So, you know, in our region and globally, the GPEI has a very systematic approach for risk analysis, and that happens at all levels in all geographies. And of course, consistently, countries affected by conflict, fragile, vulnerable countries consistently come up at high risk for polio. So GPEI investments and risk mitigation strategies are concentrated in those countries, accordingly. And a lot of the lessons learned in these fragile countries have been replicated in similar situations of conflict. So, for example, a number of lessons that we've learned in areas with active conflict, I think, are being applied in Ukraine right now as a matter of cross-learning. We've learned important lessons of how to stop outbreak in active conflict in Syria. And even it goes as far back as surveillance. You know, the surveillance design that we initially developed for poliovirus surveillance in Afghanistan was then replicated to apply in Somalia, in South Sudan, and many other countries, because that design was developed for countries with active conflict. So I think this learning continues. These innovations continue in conflict settings. This whole idea of how do you coordinate operational design with local security and conflict situation. There's a lot of learning that has happened in GPEI, and this is all being consistently applied across the globe. Back to you, Shona.
Thank you, Hamid. I'm now going to ask Melissa the final question, actually, which is a broader question, and other panelists are welcome to step in afterwards. Melissa, what is the GPEI doing to strengthen other health services and routine immunization?
Thanks. It's a good question, because integration has become a major pillar of the new GPEI strategy. So in communities, and I think Afghanistan and Pakistan are really strong examples of where working in communities where there's a demands for other services. How do we bring together other organizations and leverage other services in those areas to respond to the needs of communities, including routine immunization? I think there's a lot of lessons learned from the polio program in terms of micro-planning, community engagement that are being applied to strengthen routine immunization in zero-dose communities. And I think the focus on zero-dose communities, polio is probably a pillar example, because we're targeting every child and really targeting those that are the most vulnerable, including zero-dose children. So I think there's a lot of lessons learned and really a big focus now on integrating the work that we're doing into much broader services, including other campaigns that go beyond polio, including measles and even yellow fever, COVID, etc. So I think that now becomes one of the really strong pillars of the program, and capitalizing on the lessons learned from polio to strengthen other essential health services in complex emergencies, but also to strengthen routine. Over, Shona.
Thank you, Melissa, and thank you to all the speakers. That was the last question we have time for today, and I'd like to thank all of you, all of our partners around the world, the government leaders, donors, and most of all, the health workers for your important inputs today, and all the attendees who joined us from around the world. The last mile to a polio-free world won't be easy, but I'm confident that with continued collaboration and commitment, we can deliver on this promise. A fully funded polio program will allow us to ensure that no child is ever paralyzed by polio again. Thank you for your time.